ये सर ये जूम कनेक्शन
Dear participants, I kindly request everyone to keep your mic in mute. As we begin the program, let us seek the divine blessings with prayer video.
ले मैं चप्पल है कान को
सर्वेषां शान्तिर्भवतु
म्यूट कर दिया
सर्वेषां पूर्णं भवतु सर्वेषां मङ्गलं भवतु सर्वेषां मङ्गलं भवतु सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् सर्वेषां स्वस्तिर्भवतु सर्वेषां स्वस्तिर्भवतु सर्वेषां शान्तिर्भवतु सर्वेषां शान्तिर्भवतु सर्वेषां पूर्णं भवतु सर्वेषां पूर्णं भवतु सर्वेषां मङ्गलं भवतु
Here, I invite Ms. Tinisha K, Assistant Professor, Faculty of Nursing, to deliver the welcome speech.
Start.
Thank you, ma'am. Honorable dignitaries of the day, invited guests, faculty, and dear students who have joined the Zoom platform, a very good morning to all. I am very glad to welcome you all for this 2 days online webinar on COVID-19 Essential Preparedness organized by Faculty of Nursing in association with NSS Unit Dr. MGR Educational and Research Institute. I am happy to have given the privilege to deliver the welcome speech on this memorable occasion. I thank Lord Almighty for His wonderful grace and blessings all through this day. On this special and memorable occasion, I would like to express our heartfelt gratitude to our Honorable Founder Chancellor, Dr. A.C. Shanmugam Sir, a visionary leader behind the existence of this institution. I would like to express our profound gratitude to our Honorable President Sir, Thiru A.C.S. Arun Kumar Sir, a dynamic leader and inspiration to the youngsters. I place my sincere thanks to Thiru A. Ravikumar Sir, our Honorable Secretary, a motivating personality with a vision to take the institution to a greater heights. We are very grateful to welcome Dr. S. Geeta Lakshmi Ma'am, Vice Chancellor of a university, who motivates all of us to march towards the challenges ahead in the profession. We are all inspired by your great words, ma'am. We are indeed grateful for having spared your valuable time in gracing this occasion. Thank you and welcome, ma'am. I extend my gratitude to welcome to our today's eminent speakers, Dr. Balasubramanian Tyagarajan Sir, Dean, former Registrar, the Tamil Nadu Dr. MGR Medical University, and Dr. Shaktivel Arumugam, Director, Stanley's Academy, Chennai, former Associate Professor, Masha University, Malaysia. And I also extend my gratitude in welcoming Dr. P.S. Rajkumar, Professor in CSC Program and Program Coordinator, NSS, Dr. MGR Educational and Research Institute. I would like to welcome Professor Dr. Hema VH, our respected and energetic principal ma'am, for her insight, bird's eye view planning, and continuing to shape the Faculty of Nursing family to work in par with excellence. A warm welcome to Professor Geeta ma'am, Vice Principal, for her genuine support and expert guidance in the conduct of this occasion. I also extend my gratitude in welcoming all the executives, HODs of Dr. MGR Educational and Research Institute. And I also welcome our motivating and dedicated teaching and non-teaching staff of Faculty of Nursing who have given a wonderful operation in organizing this event. Last but not least, I welcome the whole student body, friends and invitees. Thank you one and all for being with us to make this event evergreen in our memories. Thank you.
Thank you, Ms. Tinisha. Again, I kindly request the participants, please keep your mic in mute. To have an introductory note about the event, may I call upon our beloved principal, ma'am, Dr. Hema VH. Ma'am, now it's your turn.
With my salutation to our Honorable Founder Chancellor, Dr. A.C. Shanmugam Sir, our Honorable Secretary, A. Ravikumar Sir, our Honorable President, Engineer A.C. Arun Kumar Sir, our beloved dynamic Vice Chancellor, Dr. S. Geeta Lakshmi Madam, executives, heads, faculty, and registered delegates. The theme for this 2 days workshop webinar is Nursing Mindfulness 2021. As we all know, empty mind is devil's workshop. All our minds has to be full about the happenings around in order to prepare us, especially about the devastating pandemic COVID-19. It is our bounded responsibility to follow the guidelines laid to combat this pandemic as a citizen and also to provide service to the sick as a member of the healthcare team. The sessions planned for these 2 days will enrich our knowledge as we have experts in the field to share their knowledge. We have with us Dr. Geeta Lakshmi, our Vice Chancellor, to deliver the inaugural address. I deem it an honor to introduce our Vice Chancellor to the young aspiring registrants. Madam did her MBBS from Stanley Medical College, PG from Madras Medical College in Clinical Microbiology, and PhD in Basic Sciences in Madras Medical College. Madam has served in various positions during her tenure in the government service. She has served as professor and director in the Institute of Microbiology, vice principal at Madras Medical College, dean and special officer, Government Thiruvannamalai Medical College, dean, Kirpak Medical College and Hospital, dean, Stanley Medical College and Hospital, director in the Directorate of Medical Education, and Vice Chancellor of the Tamil Nadu Dr. MGR Medical University. Dear registrants, all these positions has been acquired by her determination, devotion, and dedication. She has been bestowed with BC Roy Award for her outstanding service in the field of socio-medical relief. She has played key role during the tsunami floods and Varda cyclone, and she was instrumental in establishing the milk banks in our state. To her credit, Madam has a lot of publications and has served as chairperson for various national and international conferences. Above all, she is an empathetic administrator and an untiring leader. With this brief introduction, I invite Madam Dr. S. Geeta Lakshmi, our Vice Chancellor, to deliver the inaugural address. Thank you. Over to you, Madam.
Thank you very much. என்னுடைய காலை வணக்கம் அனைவருக்கும். It's really a pleasure to be with the nursing faculty and nursing students again, where I love them a lot because the service done by them is I cannot say in words. So they are more than nursing; it's the care they give, and always it's a highly rated profession. So today I should thank our management. On behalf of the management, we should thank A.C. Shanmugam, our chairman, our president, Mr. A.C.S. Arun Kumar, and our secretary for this, Mr. Ravi Kumar, for allowing and giving freedom for our faculty to do a lot of these educational discussive programs, which would impart knowledge and further progress in their own department as well as interdepartment. So this mindfulness is really a very good topic, and it's always, I should also say, mindfulness and heartfulness. It's not only mindfulness, it's also heartfulness, where you have to combine these two both. So mindfulness is nothing but, as you know, like whenever we do something, we should be conscious of it. That's mindfulness. So we should know what we talk, what we act, and so that's called the karma. That's what again and again I'll say. It's the karma, the act which we do should always be mindful, without hurting anybody, without causing any disruption to the nature. So it goes on. It's kind of when you are not mindful, you cause disruption in everything, in everything. So if you are mindful about what you do, what you talk, what you and what as a single person you do. So as you know, it's our body is made up of 5 elements. We have the soul. So consciousness is always, people never, whenever they act or whenever they do something, it's called the act. They are not conscious about it, and their emotions takes place. So when emotions takes place, it's the heartfulness which comes into play. So we have to combine this mindfulness and heartfulness. Whatever we do and whatever we act, it definitely it's going to implicate us. So the mindfulness is taking care, acting in so that it doesn't disrupt the society, which is helpful to the society, which is helpful to the nature. So all this together makes the mindfulness. And I think so, whomever succeeds in their life are always mindfulness. So I thank you for the nursing fraternity. And I think so the nursing requires mindfulness that has to be taught as one of the subjects during their course in each year, not only first year, not only second year, not only third year. It also combines mindfulness and heartfulness has to be taught. See, as you know, like in the school, we are taught moral science. It's nothing but they teach us the mindfulness. So the moral science, same thing has to happen even if they attend the other group. So I request the nursing principal to have these subjects before starting class by involving the students, by giving them a story which will have an impact on them. Thank you one and all for inviting me.
Thank you, ma'am, for your valuable words. While we are still reeling under second wave of COVID-19, this is spreading wider and becoming deadlier than before. The health experts have warned that a third wave is inevitable. In this scenario, it is important to have a look for preparedness for the third wave. I request Professor Geeta K, Vice Principal, to introduce today's speaker, Dr. Balasubramaniam sir. Over to you, Geeta ma'am. Geeta ma'am, please unmute your mic, Geeta ma'am. No, ma'am, you are not audible.
Hello, good morning. Good morning, everybody.
Yes, ma'am. Now you are audible, ma'am.
Yeah. Good morning, sir.
Good morning, madam.
Here I am to introduce our eminent speaker, our additional registrar, Dr. Balasubramaniam Tyagarajan, surgeon in ENT. Sir has completed his MBBS in Madras Medical College in 1980 to 1986, and he completed his diploma in otolaryngology in Kilpatrick Medical College during 1989 to 1991. Sir has completed his surgery in ENT otolaryngology in Madras Medical College during 1994 to 1997, and sir has done a thesis in fungal sinusitis during 2009 to 2010 in Stanley Medical College, Otolaryngology Department. Sir has published much more publications. Sir, we are so happy to hear this. A person done this many publications, like 107 publications, and Sir has worked as assistant professor in otolaryngology in Madras Medical College and associate professor in the same department in Government Medical College, Kanyakumari, has become a professor and the same college, Government Kanyakumari Medical College, and become a medical superintendent in Government Stanley Medical College and Hospital, and registrar the Tamil Nadu Dr. MGR Medical University. And Sir has joined our institution as additional registrar, and he is a very active person and who has encouraged us in many things. And now at present, Sir has taken in charge as dean in our own hospital, Lalitambigai Medical Sciences. Sir, we are very happy to have you here, sir. Sir is not only the person who is involved in medical side, he is very skilled in computer session also, and he has got many awards, and that he received the Best Doctor Award from Government of Tamil Nadu in 2018 and received Best Doctor Award from the Tamil Nadu Medical Association 2018. Thank you very much, sir. Stage is yours.
Thank you, madam. Thank you for your nice words. Am I audible, madam?
Yes, sir.
At the outset, I would like to thank our founder chancellor, president, our secretary for giving us this unique platform to have a discussion how we should face this unique problem of COVID. And my special thanks goes to my mentor, our Vice Chancellor, Professor Geeta Lakshmi. In fact, I'm really happy to share with you that I am a student. Hopefully, I make you proud, madam. Thank you for being present here to encourage me, to encourage all the nursing faculty, to guide us to achieve greater heights. I'm starting to share my screen. If you don't see my screen, you tell me. Do you see my screen?
Yes, sir. It is visible, sir.
You're able to see my screen, isn't it?
Yes, sir. Yes, sir.
It's clear.
Yes, sir.
Audio is
Slide
clear.
clear, sir.
Audio is clear, isn't it, madam?
Yes, ma'am. Audio also fine, sir.
I would like to start off with a special thanks to our principal, Professor Hema, who just spoke to me 3 or 4 days back, asking me to give a small insight into how to prepare for the third wave. This really sent my mind on a small trip, and I prepared a small talk for you, so that in fact I want to share some of the data which I have been accumulating, so that we will know what to do next. So we have gone through 2 waves. In fact, we have completed the first wave and we have some way through the second wave. And these 2 waves has taught us a lot. And first, I would like to tell you that this is not a normal virus. This is not a normal virus. This is not a natural virus. I'm really convinced every day I start seeing cases, handling cases. The more cases I see, the more I'm convinced that this is not a normal, natural virus. There is nothing natural about it. In the first place, the country of origin is refusing to reveal any of the data pertaining to this virus. So there is a lot of differences between the first phase and the second phase. Now, we are just halfway or say 3/4 way towards a end of the second phase. What exactly we mean by these phases? These phases are nothing but the peaks of the infection. So the first peak we had, first wave was there. We had a lull period of around 1 or 2 months, and then we took it really lightly, and then we landed up into the second wave. This second wave really taught us a lot, really taught us yeah, a lesson, a very painful lesson to be frank with you. It's a really painful lesson. Many of us would have lost some of our close relatives and family members to this dreaded disease. But all said and done, which should not deter us from preparing to face the third wave in the right earnest. So, what is going to be a scenario in the third wave? The problem is in these two waves, we found the cities, corporations, and bigger municipalities were affected the most. The third wave, I really fear, is going to hurt the villages. We should focus more on villages to get over, to mitigate the loss of life in the third wave, because the village infrastructure, health infrastructure in the village is really, we have nothing to beat about, because our health infrastructure really fails when we go to the level of the villages. So now, before starting off, I would like to dwell on a certain pointers as far as this virus infection is concerned. The epidemiologists are fond of using the term or not value. So what exactly we mean by this or not value? The or not value is nothing but a very simple thing. It is the value, it's the number, it is simply a number which states that how many people will be infected by an infected person. Supposing I am infected by COVID, if the R naught value says it is 2, so it means that I will infect 2 persons before I become free of COVID. So that is the R naught value. So this R naught value currently for COVID is around 2 to 2.5. So our main aim is to reduce this R naught value to less than 1. If you reduce this R naught value to less than 1, then only we will be able to stop the pandemic from progressing further. So now the best way, scientifically proved way of reducing the R naught value, the simple one, is to wear a double mask. And it is not sufficient if you just wear 2 cloth mask or 2 surgeon mask which we use in operation theaters. The ideal mask is when you wear the mask, you just stand in front of a lighted candle and attempt to blow the candle out. If you are able to blow the candle out, that mask is not going to be useful in protecting you against corona. So whenever you buy a mask, whenever you wear a mask, you do this small, simple test that have a candle in front of you, light the candle and attempt to blow the candle. If you are if you succeed in blowing the candle, let me tell you that mask is not going to afford any protection to you. So you need to use a mask which will prevent you from blowing out a candle while you wear a mask. So the best mask is going to be N90 mask. I can tell you that N90 mask is a difficult thing to wear these days, that too in summer. You will find it very stuffy. Ideally speaking, you can wear 2 or 3 cloth masks. And these 2 or 3 cloth masks, the advantage of this cloth mask is you can wash it regularly. You can wash it regularly and recycle it and keep using it again and again. So we are not in a situation to supply disposable mask to the entire population. So ideally, we should start supplying these personal protection kit like face mask and hand sanitizer to the village level. So the first thing we should do is educate our villagers on wearing a mask. Tell them that the ideal mask should be that you should not be able to blow out a candle while you wear the mask. So that message should go out to them loud and clear. So wearing a mask will help us to reduce the R naught value. The moment your R naught value comes to below 1, that is where your pandemic stops. So our aim is to reduce the R naught value to 1 and below 1. Right now it is hovering around 2 and 2.2. And the next is regarding this R naught value, you'll be surprised. Measles has the highest R naught value. It is around 22. The R naught value for measles infection is 22. So that is the infection. That is, if a person is infected with measles, they will go on infecting 20 more people before they become non-infectious. So that is the highest of R naught value. And right now, COVID, I don't rate it as the highest in R naught value, but the problem is it is a prolonged illness. It creates a lot of morbidity and mortality to the society. So ideally speaking, we should reduce the R naught value, bring down to 1 and less than 1. So one way of bringing it, I have already been re-stressing on wearing face mask. Number two is to immunize the vulnerable society. So how we are going to immunize the vulnerable society? Right now, the figures say nearly 10%, 10 to 15% of the city population has been immunized. Whereas if you go to the villages, the rate of immunization take a drastic dip. So villages are not being immunized currently. So we need to ramp up our immunization process for the village level population. The next is we should know that the number of old people living in villages are disproportionately higher when compared to those living in cities. So more of our old people are living in the villages. That is a very big problem. And I personally don't believe in total lockdown because after seeing the first wave, after seeing the second wave, lockdown literally serves only one purpose. It buys you time to revamp your health infrastructure. So we have seen what has happened to our health infrastructure during the second wave. We have been proved to be inadequate, woefully inadequate. People were sitting in the ambulances for hours together to get a bed in a hospital. So that was the state of affairs in a metropolitan city. Now, what will happen if this scourge is going to take over, affect our village population? That is where we should sit up, plan our resources in such a way that we should protect our village level population, particularly the village elders, by immunizing them at the as a top priority. So that is one of the two ways of reducing the R naught values. One is wearing a face mask, personal hygiene. And then the second is by ramping up the immunization. Now the next thing is we should evolve a uniform treatment protocol which should be followed both by private institutions as well as government institutions. This is where we have gone wrong in our second wave. In fact, I have seen private institutions start on steroid, start on anticoagulants, start on remdesivir on the first day of admission itself. So supposing if the first patient will have had a saturation of 98, the patient would have said, I had fever for 3 days. They would have got admitted on the third day in the hospital, second or third day of admission, or second or third day of illness, they would have been started remdesivir. I would like to point out that remdesivir has not been proven to be the drug of choice in the management of COVID. And treatment with steroids and anticoagulants should be done as a last resort and not as a first resort. You got to be very patient, observe the patient, wait for the oxygen level to dip. If the oxygen level is dipping, you can go ahead and supplement or treat these patients with steroids and anticoagulants. Let me tell you, we still don't know why some of the people die with COVID and why some of the people have very mild infection. In fact, they don't even know that COVID has infected them. So with such poor knowledge of this infection, there is no point in starting medicine, starting drugs. The second important thing I want to stress is people have started consuming huge doses of zinc, hearing that zinc is going to improve your immunity. As far as my knowledge goes, only thing which will stimulate your immunity to react is another virus or bacteria against which the immune system will have to protect you against. So your zinc or B complex or vitamin C will have a very, very, very minimal effect on your immune system. So don't believe that your immune system will become Mount Everest and it will stop the infection when you consume huge amounts of zinc. So what is happening is people are taking 2 or 3 capsules of zinc capsules per day. And let me tell you, zinc happens to be a very good nutritional environment for fungus to thrive. Supposing now you see a plethora of cases, you give a lot of color code to the fungus, ironically, white fungus, black fungus, yellow fungus, I don't know where they get these terms from. Press is notorious for using these slangs to grab the attention of the viewer or a personal goes. We know only Candida, we know Aspergillus. So these are fungal infections. They thrive in an environment where there is plentiful of zinc. So we should always avoid consuming too many zinc capsules. So ideally speaking, it is sufficient if you take 2 to 3 capsules a week. I repeat again, ideally speaking, you can take only 2 to 3 capsules a week if you really don't want to be, if you're a diabetic and if you're going to be put on steroids. Along with it, if your zinc level is high, that is going to be a potent source for fungal infection. That is the reason why I really believe that a team of experts should be constituted to evolve a common treatment protocol for COVID. So this protocol can be divided into 3 heads, one for the primary health center level, next is the district hospital level, and third is the higher center or medical college level. So these 3 level or A, B, C protocol will have to be evolved, and this protocol should be publicized among the medical fraternity with instructions saying that everyone should follow this protocol. In fact, not long before, when we had a dengue epidemic, our VC madam was instrumental in evolving a common protocol which even the private institutions followed. That is not the case now. Every hospital, you name it, they follow another protocol. They would start remdesivir on the first day of fever. I don't know what purpose it is going to serve, because it has not been proved to be useful. In fact, so many papers are being published currently saying that remdesivir is not of much use in COVID infected patients. So that is the reason why I have nothing against remdesivir. But the problem is, if this is going to help us, none of these patients, even after getting remdesivir, should die. In fact, many of these patients who die in the hospital have already received remdesivir, let me tell you. Even despite them receiving the full course of remdesivir, we have lost nearly 99% of the patients on ventilator, and we have lost 30 to 40% of our patients in high flow oxygen. So that is a stark reality which we are confronted with. So the next thing we should do is evolve a common protocol and ensure that it is complied with by all, one and all, by the private as well as the government doctors. Now, the third thing is we need to revamp the rural health infrastructure. How are we going to go and revamp the rural health infrastructure? The thing is, you all know that every 10,000 population, you have a primary health center. You have a village health nurse for every 1,000 population. So the village health nurses should be provided with pulse oximeter, and the PHCs should be provided with oxygen supply. Every PHC should have at least 5 to 10 oxygen beds that should be available at the primary health center level. Because let me tell you, during the second COVID wave, we found nearly 3% of the affected COVID positive patients needed oxygen support. I remind you that we found out during the second wave, literally nearly 3% of the COVID positive patients needed oxygen support. So using the same analogy, if you say a 10,000 population at the primary health center level, put this figure, you will know that for 10,000 population, 3%, if they need oxygen bed, where are they going to get from? Unless and until you equip the primary health center beforehand to face this disaster. So if this 3% this 3% number should be inside our head. 3% of the COVID positive patients are going to need oxygen support. So if this 3% should be provided somehow, and that too at a war footing. And the next is going to be your oxygen delivery system. So we all keep talking about ventilator, ventilator, ventilator. Let me confess, ventilator, if you are putting the patient on a ventilator, you are not 99.9%, you are not going to get him back alive. That is what I have seen as far as COVID is concerned. So on the other hand, I have seen a lot of lives being saved on being connected to a CPAP or BiPAP machine. So at a cost of one ventilator, we can buy 8 to 10 CPAP machines. Let me tell you, I repeat again, the cost of one ventilator, we can buy 8 to 10 CPAP machines. So we should provide CPAP support or BiPAP support at the level of primary health center. It is not a rocket science, it's very simple equipment, very portable. It can be installed very easily, in a primary health center setting. And patients should not, we should believe in one thing, we should not lose any patient for want of oxygen. That should be the only message we should carry to the society. We should not lose even a single life for lack of oxygen. So we should ensure that we provide 2 to 3% of the population with oxygen beds at a district level and a primary health center level. And then we need to have liquid oxygen plants, because liquid oxygen is the most easy and good way of transporting oxygen. Instead of transporting them in a cylinder, liquid oxygen is the best way, economical way, more efficient way of transporting oxygen to the areas where it needed. So every district level, they should have, at the level of the district level, they should have liquid oxygen plants. And from there, they should start filling up these cylinders and deliver them to the primary health center and district hospital level. So oxygen filling stations should be available at the level of the district. In addition to the liquid oxygen plant, oxygen filling station should be available. At least 2 per district should be there. And I have already told you about these CPAP and BiPAP machines, which are really economical, which are really a cost-efficient way of saving lives, COVID affected persons' lives. So in fact, this pandemic, I have learned a very, very good lesson that CPAP and BiPAP has managed to save majority of the population. Even when we use a ventilator, we prefer to use it in the non-invasive mode. So we use a ventilator in a CPAP or BiPAP mode. So why you want to spend so much money on a ventilator when you're going to use it in a CPAP or BiPAP mode? You can as well go for a CPAP or BiPAP machine, which is economical. So at the cost of one ventilator, you can buy 10 or 8 to 10 CPAP machines. So ideally speaking, we should focus on providing more and more CPAP machines or BiPAP machines to the district hospitals and primary health center levels. So every primary health center as well as your village health nurses should be provided with pulse oximeters. They should be educated thoroughly. They should be taught how to diagnose this problem, how to look for the symptoms, because they are the first contact for these poor village patients. So all the village health nurses, they are the first point of contact to these poor villages. So they should be empowered. So next is what we'll do is we will see how we are going to empower our village health nurses, because empowering our village health nurses is going to really save a lot of our lives, rural lives to be particular. The next, these village health nurses should be taught how to manage these patients. They should be provided with enough tools like digital thermometer to measure the body temperature. They should be provided with pulse oximeter to check the oxygen saturation. They should be taught how to look out for the warning signs of hypoxemia. So this knowledge should be available to the village health nurse. The next is we should, every village really respects that school teachers. So the school teachers and headmasters should be really told or taught about this problem, and they should be provided with enough infrastructure to, like pulse oximeter and digital thermometers, to measure the body temperature, to diagnose this problem. And ambulance facilities should be provided at the village level to shift those patients who need high flow oxygen therapy to the nearest district or medical college hospitals. The district hospitals should be provided with high flow oxygen equipment so that if the oxygen equipment which is available in the villages is insufficient to meet the saturation requirement of the patient should be shifted with immediate effect to the district headquarters hospital or a nearest medical college hospital in order to save their life. So to summarize, let me tell you, we have enough pointers from these two waves to learn that this is not going to be a small problem. This is going to be a huge problem, and we should be prepared to face the problem. And these are the broad ways in which we can prepare ourselves to face this problem. It's easily said than done, but the best is going to be immunization. And next is going to be you are masking the patients. So immunization again, you need to revamp the immunization scheme entirely and ensure this immunization is done on a house to house basis instead of asking them to come to a single place and get inoculated. It will be better if VHNs go house by house and inoculate patients. That will be better because our intention, even in the third wave, is we should prevent crowds from grouping. So we should ruthlessly cut down groups. We should maintain social distancing. We should ensure that marriage ceremonies are frugally conducted. Temple festivals and religious festivals are really curbed. And even the shandies, the sandhan solvang, that is what I fear the most. So that they should be regulated in such a way that proper social distancing is maintained. For this to happen, it cannot be done at the state administrative level. It should be done at the local body level. So we should empower our local body members, panchayat members, and we should give them adequate training. We should give them adequate powers because disaster management powers, they got the power to give control to the local body, and they should be even powers to lock down areas in a local manner. So they should the local lockdown is the only thing which is going to work and not a total lockdown. So we should watch out for these cases. We should do a lot of testing. We have been telling you keep on testing, testing, testing. Without testing, you will be really sleeping, and ultimately one day disaster is going to strike. So we need to keep on testing, ramp up the testing, test as many suspected cases as possible. The moment you see that 5 to 6% of the cases samples taken, if it becomes positive, it is better that you cordon up that area and you ensure that the local lockdown is carried out. So if only you start testing more, we will know the areas which needs to be locked down locally. So instead of locking down the entire country or the entire state in the saying that it's going to be a total lockdown, we should focus more on testing and localized, highly localized, targeted lockdown. Targeted lockdown is what we should do. In fact, US has started lockdown in a targeted manner. Small localities, small areas, small boroughs are being locked down instead of the larger cities. So let us focus on more testing, more immunization, and if the test results turns out to be 5% of the sample, if they turned out to be positive, you ensure that you have a highly localized lockdown. So with these few insights, I would like to conclude my speech. If you have any doubts regarding the topic I have spoken, you are welcome. I would love if some of you could watch out in the chat box and give out the questions. Since there is one topic on immunization, I thought I refrained from speaking on vaccines. But if you have doubts regarding vaccine, you are welcome to ask now. No issues. Thank you, madam. Thank you, one and all.
Thank you, sir, for your valuable thoughts. Now it is time for discussion. Stella Angel,
Yes, ma'am.
can you please read the questions? Any questions are there in chat box?
A few questions are there, ma'am.
Okay, Stella, over to you.
Good morning, sir.
Morning, madam.
There is one person who asked, how long will this wave will go on?
Actually, madam, there is no time frame as far as this wave is concerned. As I've been telling you, the moment R naught value goes down below 1, the wave stops. So our aim is to reduce the R naught value to below 1. The moment you reduce R naught value to below 1, the wave stops. As simple as that.
Okay, sir. Thank you, sir. The next question is, sir, what is the difference between the second wave and the third wave?
No, third wave we are yet to face, madam. We are in the second wave, 3/4 of the second wave. Third wave, I don't know, because we could escape third wave if you take adequate precautions. I don't get the question. If you want to know the difference between the first and second wave, maybe I can tell you.
Okay, sir. Thank you, sir. No more questions in the chat box now.
Okay. Okay.
Thank you, Stella. Thank you, sir, for answering the questions.
Thank you, madam.
Okay, next, we will move to the second session of today's event. In the current pandemic situation, it is foremost to have an overview about the COVID vaccination. So here we have Dr. Satyavel, sir. He is a director of Study Breeze Academy and a former professor from Malaysia. I request Mrs. Akalya, assistant professor, to introduce our speaker. Over to you, Akalya, ma'am.
Thank you, ma'am. Good morning to one and all. Learning gives creativity, creativity leads thinking, thinking provides knowledge, knowledge make you great, said by Abdul Kalam. Today we have gathered here to hear, learn, think and gain knowledge. On behalf of our management and faculty of nursing, it's my great privilege to introduce today's speaker, Dr. Saktivel Arumugam, PhD in medical biochemistry. He has completed his MSc and PhD in medical biochemistry at Madras University. He started his career as a lecturer and PhD coordinator in Savita Medical University, Chennai. He worked as a lecturer in Seba Medical College at Libya. He formerly working as associate professor in biochemistry, Faculty of Medicine, Maza University, Kuala Lumpur, Malaysia, for more than 10 years. His academic credentials: he has 14 years of experience in teaching biochemistry in nursing, allied health sciences, medical, and dental colleges. He successfully published over 25 articles in reputed international journals. His extended his role in member of academic board, MBBS student selection, interview panel member, internal audit committee member, mentor for students. He organized many seminars and conferences. He presented papers in both national and international conferences. He has written chapters in textbook of functional ingredients from algae for foods and nutraceuticals. And also is the examiner for PhD thesis for both India as well as abroad. He is a member in editorial board of scientific journals, namely Journal of Academia and Industrial Research, International Journal of Current Biotechnology, Journal of Modern Biotechnology, and also he is a member in Malaysian Association of Clinical Biochemists, Association of Biochemistry Professionals Social Network, Association of Clinical Research Professionals. He has been awarded in Tamil Nadu Government Junior Research Fellowship from the Government of India. And also he won the Best Paper Award in CSIR sponsored national seminar on marine biodiversity as a source of food and medicine. And also he received a Best Employee Award from Maza University in the year of 2050. He's a dynamic and dedicated leader and also good teacher. He's going to speak on COVID medicine overview. Sir, please.
Good morning, one and all, those who are present here. I am Dr. Shaktivel. Am I audible?
Yes, sir.
Yes, sir.
Yes, sir, audible.
Sir, you are not audible, sir.
Hello, can you hear me?
Yes, sir. Now it is audible, sir.
Okay, sorry for the technical glitch. Let me introduce myself. I am Dr. Shaktivel. Thanks for giving me the opportunity. I would like to thank Professor Dr. Hema, Principal, Faculty of Nursing, and Professor Geeta, Vice Principal, Faculty of Nursing, Dr. MGR Educational and Research Institute. It's been very pleasure to have a wonderful audience here. Let me start with, I'm going to share my experience, share my knowledge in COVID-19 vaccines, and overview. I don't want to go in detail about the coronavirus. Most of us know about the coronavirus and other things. Before, I will just touch upon the COVID-19. COVID-19 is a disease which is caused by coronavirus called SARS-CoV-2. This type of coronavirus have not seen before when there is no, this is a very new virus found, and get COVID-19 through contact with another. So what is the source of contact? Through contact with another person who has the virus. It's predominantly respiratory, it will cause the respiratory illness that can affect other organs. And people with COVID-19 may experience with wide range of symptoms. Already all of us are aware. And we will start with the COVID vaccines. Why the knowledge of COVID vaccine is important? We must know the accurate and evidence-based information about COVID-19 vaccines, which will provide the people with essential facts about the vaccine that will help to end this crisis. So this is very, very important to know. There are a lot of myths and misinformation among the society, about the COVID vaccines recent days. So we need to know the accurate evidence-based information about COVID-19 vaccines to provide people with the essential facts about the vaccine that will help to end the crisis. There are 4 types of COVID vaccines in clinical trials. Those are, one is whole virus, the second one is protein subunit, the third one is viral vector, and fourth one is nucleic acid, that is genetic material, RNA and DNA. Each of which protects people, but producing immunity in slightly different way. There are 4 different vaccines are in clinical trial, and 4 different vaccines are providing the immunity to the people in different way. We will go one by one. And the first one is viral vector and RNA nucleic acid, that is RNA ribonucleic acid. The both are from the genetic material. The first one is viral vector, which uses a harmless virus. Okay, this consists of a harmless virus which is altered to contain a part of COVID-19 genetic code. You know all very well, genetic code is the genetic information which will transfer through the translation. In the protein synthesis, it will create a protein that will give the immune response in the immunity. The second is RNA, ribonucleic acid. This is called a messenger RNA. Excuse me, messenger RNA. It contains a synthetic version of part of COVID-19's genetic code. Again, it is having a genetic code of messenger RNA of COVID virus. It will also, it will be when we are administering this vaccine, it will also create, it will involve in the protein synthesis. That protein will give the immune response against the COVID-19 infection. The next is the whole virus. It's a traditional method. This is a traditional method. It contains a weak inactivated version of COVID viruses. Okay, it's a traditional method. It is having a inactivated, a weakened version of COVID virus. When you are administered, this will not create the COVID infection, but it will create the immune response against the virus. Next one is the protein subunit. It uses the piece of COVID-19 virus, sometimes as fragment of protein. It's a protein itself, it's a spike protein. It will also trigger the immune response against the COVID infection. There are types of vaccine that I already told you. There are two, broadly in India, we are taking 3 vaccines, that is Covaxin, Covishield, and Sputnik. And inactivated vaccines are Covaxin, and the rest of 2 others are viral vector vaccines. And we need to know the facts of COVID vaccines, because there are myths and misinformations about the COVID vaccines in society. As with any drug or vaccine, any drugs or vaccine, separating from fact and fiction is critical. It can be increasingly hard to do with amount of noise. Okay, so already we know, we are aware that there are many misunderstandings about the COVID vaccine in the society. It will cause the side effects, and there are other practices. They will cause some misinformations, and these are all the misinformation we need to eradicate. Then only it will reach the audience to take up the vaccine without any hesitation. And important to know, very, very important to know, how safe are COVID vaccines are. Ultimately, the purpose of the COVID vaccines or ultimate safety is paramount through the entire vaccination development. Already the companies which are developing the vaccines, they are considering the safety in mind, and the regulatory authorities also approving on their basis. Moreover, any possible risk that may exist are considerably lower than those associated with COVID infection, even though there are some side effects are there still, but when it's compared to the efficacy, it is less and vastly outweighed by the benefits of protecting people and preventing the virus from the spreading. That is the ultimate aim of vaccines, the ultimate aim of COVID vaccines. Now, we will discuss about the vaccines which is available in India. Those are Covaxin, Covishield, and recently ICMR has allowed Sputnik V. It is from Russia. We will discuss one by one. The first one is, we all need to know the information that can be trusted about the vaccine. Misinformation and false claims threaten the undermine the success of vaccines and put people's life at risk. In the during the second phase, the COVID-19 vaccination drive already has begun in India, and many people are still unaware how 2 vaccines. I'm comparing mainly I'm comparing Covaxin and Covishield are different from each other, because these administered large scale. That's why we are comparing the Covaxin and Covishield. Then later we'll discuss about Sputnik. And most of them, they're curiously asking which is more better, which is more efficient, either Covaxin or Covishield. Well, we have compiled all the information to give a better understanding of the formulation and every other detail about the vaccine you are going to get, and ultimately to save from the coronavirus. The first one is Covishield. The Covishield. What kind of vaccine is Covishield? It's already I told you, it's a recombinant replication deficient chimpanzee adenovirus vector encoding the SARS-CoV-2 spike glycoprotein. Chemically, it's a recombinant replication deficient chimpanzee adenovirus vector encoding the SARS-CoV-2 spike glycoprotein. When the following administration, the genetic material of part of coronavirus is expressed, which stimulates an immune response. We all of us know the process of protein synthesis. All right. So we need protein, especially all the immunoglobulins, which is are proteins. All the antibodies are protein. So when we are addressing this Covishield vaccine, excuse me. When we are administering the Covishield vaccine, so it will express it, which stimulates an immune response against the COVID virus, which will give a response of Covishield has been prepared using the viral vector platform, which is totally different technology from other vaccine productions. A chimpanzee adenovirus has been modified to enable it to carry the COVID spike protein, already I told you, into the cells of human. Well, the cold virus is basically, it is incapable of infecting the receiver. Even though it is having the spike protein, it will not infect the receiver, but can very well teach the immune system to prepare the mechanism, to produce the mechanism against such viruses. So even though it is having the part of coronavirus, it will not infect the receiver, but it will create a response. It will express the response to produce the protein against the coronavirus. The exact technology was used to prepare vaccines for viruses like Ebola. So this technology, by the same technology, the vaccine of for Ebola virus have been prepared. And if there is any difference between first and second dose of Covishield? No, there is no difference between first and second dose of Covishield. Each dose has the same content of viral particles. There is no difference between first dose and second dose of Covishield. Okay. Can people take people with comorbidities like hypertension, diabetes mellitus, asthma, or cardiovascular disease receive this vaccine? According to the Covishield information fact sheet, the Covishield has been administered in people with or without comorbid condition in clinical trials. Actually, there is no proper adequate information is available as of now, because this vaccine is immediately introduced without vast or extensive clinical trial because of the timely reasons. So trials and safety profile was comparable in those with or without comorbid condition, but still the clinical studies on animals shows the people with clinically stable comorbid conditions can receive the vaccine, but even though, kindly follow up with your treating physician for a risk benefit assessment based on clinical judgment before taking the vaccine. Especially, it is advisable if the person with comorbidities can get their physician opinion before taking the vaccine. What are the adverse effects generally can get after the vaccination, that is after getting Covishield? The following side effects of adverse reactions have been reported with Covishield vaccine. They are common to rare. Okay, we are listing out, we are categorically listing out from less to moderate to rare. The first one is very common, may affect more than 1 in 10 people. What are those? Tenderness, pain, warmth or itching where the injection is given, generally feeling unwell, so general discomfort, and feeling tired, that is fatigue, chills or feeling feverish, headache, feeling sick, joint pains or muscle. This is very common, and most may affect more than 1 in 10 people. And common, the second one is this is also may affect 1 in 10 people. Swelling or redness where the injection is given, fever, being sick, sometimes vomiting or diarrhea, pain in legs or arms, flu-like symptoms, and such as high temperatures, sore throat, running nose, cough, and chills. These are also a common adverse effects. Uncommon, the third one is uncommon, may affect 1 in 100 people. Sleepiness, they feel dizzy, drowsy, abdominal pain, enlarged lymph nodes, excessive sweating, itchy skin, rash, and hives. And not known, there are few adverse effects are not known still. The frequency cannot be determined from the available data. There is no data is provided, but there are people have symptoms with report the severe allergic reactions, anaphylaxis, severe swelling of the lips, mouth, throat, which may cause difficulty in swallowing or breathing. And the next one is rarest side effects. Those are major blood clotting, either in venous or arterial thrombosis, in combination with low platelet count, there's thrombocytopenia, have been observed very rarely, with frequency is less than 1 in 100,000 vaccinated individuals. And these are all the common adverse effects of Covishield vaccination. And still we need more data to be provided to know the complete adverse effect. Okay, next one is, can pregnant women receive Covishield vaccine? There are limited experience with use of vaccine in pregnant women. Preliminary animal studies do not indicate, so far the animal studies do not indicate or direct or indirect harmful effects with respect to pregnancy and embryo fetal development, patuation or postnatal development. Definitive animal studies have not been completed yet, still under research. And the full relevance of animal studies to human risk with vaccines for COVID-19 remains to be established. Still need to do more research. And administration of Covishield in pregnancy should only be considered when the potential benefits outweigh any potential risk of for the mother and fetus. The next one is, can women on their periods can receive Covishield vaccine? There is no, as per the data sheet of Covishield, fact sheet of Covishield, there is no correlation between menstruation and the effect of the vaccine. Moreover, this is a physiological phenomenon that has nothing to do with immunity. Women on their periods can take the vaccine. In fact, there is no prohibition to take any vaccine during menstruation. This is what given in the fact sheet of Covishield. Can breastfeeding mother, next is, can breastfeeding, Agalya.
Hello, sir.
I think there is a technical glitch. We'll just wait.
Yes, ma'am. Sir, slide is visible, but it is not audible, sir. Your voice is not audible.
Now, am I audible?
Yes, sir. Now it is audible, sir.
Okay, extremely sorry for the technical glitch.
No issue, sir. Please continue.
Okay, let's start. Can breastfeeding women receive Covishield vaccine? It is unknown whether Covishield is excreted in human milk, that is from the mother's milk, Until now, there is no research is providing the data whether the mother's milk contains Covishield after taking the Covishield vaccine. However, the current guidelines of the Indian government state, COVID-19 vaccination is recommended for all lactating women. It is recommended for all lactating women. WHO guidelines state the vaccine efficacy is expected to be similar in lactating women as in other adults. It is same compared to other adults. Since Covishield vaccine is not a live virus vaccine, it is not a live virus vaccine. It is biologically and clinically unlike to pose risk to the breastfeeding child, because if there is a live virus, yes, it can affect the mothers, and if it's not a live virus, so it will not affect the woman who is part of the group recommended for vaccination according to the WHO prioritization roadmap. Especially examples are health workers should be offered vaccination on an equivalent basis. WHO does not recommend discontinue breastfeeding after vaccination. So still they are recommending to mothers to give the mother's milk to the newborns. It is advisable that breastfeeding mothers should consult even though there's no risk. It is advisable that breastfeeding mothers should consult their healthcare provider for their risk benefit assessment based on the clinical judgment before taking the vaccine. Next is what is the effect of Covishield on fertility? Preliminary animal studies do not indicate, that is initial studies do not indicate either a direct or indirect harmful effect with respect to the fertility, but still need to do research on humans, then only we can be able to say 100%. Next is, if you ask me, how long will the vaccination protect me against COVID-19? The Covishield will protect me after COVID-19. And so far, there is no data is provided. The duration of protection has not been established, but still it is having the efficacy like other vaccines. If you're taking, you will be prevented from COVID infection. The next vaccine we are going to discuss is Covaxin. So Covaxin is the vaccine. It is India's first indigenous COVID-19 vaccine. That is the first, we can proud to say it's India's vaccine. Covaxin has been developed by Hyderabad-based Bharat Biotech in association with ICMR and National Institute of Virology. The indigenous, this vaccine also contains inactivated vaccine, is developed and manufactured in Bharat Biotech. The vaccine is developed using whole virus inactivated virocell derived platform technology. The technology, inactivated vaccine do not replicate. Usually, when we are taking the genetic material, usually to do the replication, you know very well, from the cell division, replication, translation, and transcription, finally the proteins are synthesized. But even though the genetic material is insert, there's no adverse effect. There's no replication of virus is seen in this vaccine. They contain dead virus, incapable of infecting people, but still able to instruct the immune system to mount a defensive reaction against an infection. Already I told you, Covaxin is an inactivated vaccine which has been prepared on tried and tested platform on dead viruses. The vaccine is developed with whole inactivated virocell derived technology. They contain inactivated virus. These conventional vaccines have been used for decades now. This methodology is a traditional methodology. I already told you in the introduction. This is the oldest method of preparing the vaccine. These are vaccines for some other diseases as well, which are made using the same technology. Those are seasonal influenza, rabies, polio, and Japanese encephalitis. And the doses, again, we'll move to the doses. There is no difference between the two vaccines in terms of dosage, like Covishield. Both of them follow a 2-dose regimen administered 28 days apart, from 0 days to after 28 days. Storage guidelines of these vaccines, both Covishield and Covaxin can be stored at 2 to 8 degrees centigrade, which is a household refrigerated temperature. And this makes both the vaccines most suited for Indian conditions, as most of the vaccines here are kept at the same temperature, same room temperature, same temperature range. This also makes the transportation and storage of both vaccines easier. Next is, you should mention before you get vaccine, like Covishield. Before administering the vaccine, you need to inform if you have any comorbid conditions. Tell the officer supervising your vaccination about all your medical conditions, including if you are on a regular medication for any illness, or for how long, for which condition you are taking the medicine. And it is advisable not to take the vaccine if any of this condition have any allergies, fever, bleeding disorder, or on any blood thinner, or any immunocompromised conditions, or on the medicine that affect your immune system, or not like Covishield. Covaxin, they're giving precautions for the pregnant women and breastfeeding mothers. Okay. Who should take the Covaxin? Already the government have been announced. If you're a normal individual who are 18 plus 18, from 18 years onwards, they can take this Covaxin vaccine. And who should not taken, already I told you, those who are having allergies and comorbid conditions, they have to consult the doctors before taking this vaccine. And what is the chemical composition of Covaxin? This Covaxin contains of the already told you whole virion inactivated SARS-CoV-2 antigen, and also it is having the chemical compound aluminum hydroxide gel and 2-phenyl phenoxyethanol and buffer saline. These are all the composition of Covaxin. And again, now we will come to an important point. What are the benefits of Covaxin? Most of us are very much particular about the efficacy. In ongoing clinical trial, Covaxin has shown to generate immunity following 2 doses given 4 weeks apart. Those who have taken the 2 complete doses of Covaxin and shows 81% of efficacy. Hence, it is very important and appreciate that receiving the vaccine does not mean that other precautions related to COVID-19 need to be followed. So even though if you are taking 2 doses of COVID vaccine, it is having 81% of efficacy, still you need to follow the COVID-19 protocols. And Covaxin, the country's first indigenous COVID-19 vaccine, was developed by the National Institute of Virology. The same thing, this is the information about the Covaxin. This is very, very important to note that the Covaxin found to neutralize 617 variants of COVID-19. It is said by Anthony Fauci, who's the administrator, the US administrator. There's a press release from the US. It has been proved that Covaxin found to neutralize 617 variants. It's a really good news, those who are taking Covaxin. What are the risks of Covaxin? What are the adverse effects, side effects of Covaxin if you're taking? The side effects that have been reported with Covaxin include same thing. This is mild to moderate, swelling, redness, itching, headache, fever, malaise, body ache, nausea, and vomiting, and races. A severe allergic severe allergic reactions may very rarely occur after getting a dose of Covaxin. These may not be all the possible side effects of Covaxin. Serious and unexpected side effects may occur. Covaxin is still being studied in clinical trials. So we cannot say 100% it is having a minimum side effects. Yes, there are few cases that have been reported with the severe side effects. Still need to be do a lot of research to prove this. What if you are pregnant or breastfeeding while taking Covaxin? If you are pregnant or breastfeeding, you should not get the vaccine. It's unlike like Covishield. The Covaxin fact sheet itself telling if you are pregnant or breastfeeding, you should not get the vaccine, as the effect of vaccine has not been studied in pregnant women and nursing mothers. It's very, very important to know those who want to take the Covaxin if you are pregnant or breastfeeding. Okay, so it's very, very important. There are side effects of one of the important side effects of Covaxin is related to coagulant. What if I am a blood thinner or coagulant? Individuals on stable anticoagulation therapy who are up to date with their scheduled international normalized ratio INR testing and whole latest INR was below the upper threshold of their therapeutic range. Still, Covaxin is telling those who are taking, they are in anticoagulation therapy, still the risk is very less while taking this vaccine, and who have a stable medical disease condition assessed by the vaccination provider may receive, how they have to receive intramuscular vaccination. While taking this, the bleeding may take a little longer when compared to the other people. to stop in these individuals and may lead to increased bruising on the upper arm. The immunization of patients with bleeding disorders differ from that of average population. That is different from the normal person for the vaccination in these individuals, followed by a firm pressure applied to the site without rubbing for at least 2 minutes. So in case of any doubt while taking this vaccine, if you are an anticoagulant therapy, individuals with bleeding disorders may be vaccinated intramuscularly if, in the opinion of a doctor familiar with the individual's bleeding risk, the vaccine can be administered with reasonable safety. With all the precautions, they can take this vaccine. What if I have allergies? Yes. Again, this covaxin, already we have discussed about the composition of the covaxin. If any of this composition may triggers the allergy, so it is better to get vaccinated after consulting your consultant. If you have any previous allergy or drug allergies or any other allergies, you have to take the consultation after taking this, then take this vaccine. Okay, what if I am immunocompromised? There are a sector of people with HIV infection or other immunocompromising conditions, or who take immunocompressive medications or therapies might be at risk of severe COVID-19. Already, this virus will suppress your immunity. So these individuals are always at high risk. However, the data is not clearly available to establish vaccine safety and efficacy in these groups. But the individuals with immunosuppressants may not generate a full immune response to COVID-19. So because already they are having immunosuppressant, so they cannot take, if you take the vaccine also, they cannot get 100% immunity. Especially the transplant recipient should be counseled that the vaccine's effectiveness and safety profile of them. Those who are they have received the organs from donors, they have to consult and counsel before taking this vaccine. The transplant recipients may have a weakened immune response, obviously, compared to the general population. Thus, they should be advised regarding the importance of maintaining all current guidance to protect themselves even after vaccination. And immunocompromised individual may receive COVID vaccination if they have no contraindications to vaccinations. Still, because of the traditional method, you are taking the whole virus in the vaccine. Is advised to take this. Is the vaccine itself caused the COVID-19? No. The covaxin is an inactivated. It contains the inactivated viruses. It will not cause any COVID-19 infection, and hence there's no chance of getting COVID-19. This is what the fact sheet is telling. And last one, the third vaccine which is available, recently available in India, that is Sputnik V. The third coronavirus vaccine has been approved for use in India amid a deadly second wave of infections. That is none other than Russia's Sputnik V, have been deemed to be safe and works in a way similar to the Covishield. Similar, exactly. It is mimicking the actions or mimicking or parallelly like Covishield. But as per the results are showing, the Sputnik is having more efficiency than Covaxin and Covishield. That is the highest, we can say this highest. Sputnik V gives around 92% protection against COVID-19, and late stage trial results published in Lancet. And one of the eminent journal, Lancet, it is published in the Lancet. It is giving 92% of efficiency. About Sputnik COVID vaccine, the Sputnik have been developed by the Russian Institute Gamaleya National Research Center and Epidemiology and Microbiology. The Sputnik V, how it is lyophilized. It is in the dry form of vaccine that make it exporting to international markets easier due to simplified requirements of storage temperature. Since it is lyophilized, it is in dry form, it is easy to import to any countries at the 2 to 8 degrees Celsius. And again, the adverse effect is like other vaccines, but here the Sputnik is clearly mentioned that pregnant women are advised to avoid taking Sputnik V vaccine. Still, the research is going on. Until that, the pregnant women are avoided to take Sputnik virus vaccine. How does two shot of Sputnik virus works? The Russian COVID-19 vaccine Sputnik is an adenoviral-based two-part vaccine. It is used it is composed of weakened virus to deliver small parts of pathogen stimulates an immune response. It's like a Covishield. It consists of a genetic material of COVID virus. It will create the immune response after administering. So Russian researchers extracted the fragment of genetic materials, that is the code of the complete COVID virus genes are sequenced. From the gene sequence, a particular portion is taken from SARS-CoV-2, which codes information about the structure of the spike S protein. You know very well about the genetic material RNA and DNA. They are the templates. They are the templates for the synthesis of new protein. So the particular portion of the virus is taken. That portion is the responsible to synthesis of the S spike protein. The protein forms the virus crown and is responsible for the connection with human cells. So that will given the immune response in the human body. The researchers inserted the spike S protein into a familiar adenovirus vector for delivery into the human cells. To ensure lasting immunity, the Sputnik uses two different types of adenovirus vectors. It is taken from two different adenovirus vectors for the first and second vaccination. It is not like the Covaxin and Covishield. Each dose have a different composition, which is said to boost the effectiveness of the vaccine. What is the Sputnik's efficacy? What is the efficiency rate? I already told you, compared to the other two vaccines, Covishield and Covaxin, it is the highest efficiency. As per the Lancet journal, it is 92%, but the promoter is telling 95%. As per the February 2021 peer-reviewed journal, Lancet, Sputnik published trial showed 91.6% of efficacy against COVID-19 virus. But the efficacy evaluation was carried among of 18,794 volunteers on 28th day after the receiving the second dose of vaccine. Based on the analysis, the Russian Direct Investment Fund announced Sputnik as the efficiency at 95%. Until now, this is the highest efficiency in the vaccines available in the world. Now we will compare the three vaccines for our better understanding: Covaxin, Covishield, and Sputnik. It is put in a comparison chart. Who are the developer? First, we'll start with the developer and manufacturer. Covaxin is developed by Indian Council of Medical Research (ICMR) with the NIV, National Institute of Virology, and Covishield is developed by the AstraZeneca and Oxford University, and Sputnik is developed by Gamaleya Research Institute, Russia. And technology, already told you there are 4 different types of vaccines are available. Which technology? The vaccines are three vaccines are produced. The first one is Covaxin. It is an inactivated SARS-CoV-2 virus, inactivated virus. And Covishield is virus vector. It's a traditional vaccine, traditional methodology of vaccine. And Sputnik also, it's a virus vector vaccine. So this is the methodology of synthesis of 3 vaccines. And the doses, what is the different doses? All 3 vaccines are taken 2 doses. And Covaxin, there is no difference, first and second dose. The first dose, initially they told is 4 weeks, now it will increase to up to 6 weeks. That is Covishield, from the first day, they have increased to 8 weeks of time as for the gap between the first and second dose. The Sputnik is the first dose, and after 21 days, you can take the second dose. This is the doses, the days difference between the 2 doses of administration. Efficacy, the Covaxin has 81% of efficacy, and this data is also have been published in Lancet. The phase 2 data have been published in the eminent journal Lancet, but the phase 3 data is not peer reviewed, so still under research. It is peer reviewed, still under the research. Covishield is having the efficacy of 71%, and interim analysis published in the Lancet. This information also published in the Lancet, and still the research is going on for the other point of views. Sputnik V is highest among all 3 vaccines, 91.6 as per the Lancet journal, and interim analysis published in the Lancet. Still the research is going on the other parts of other views. And does it, if there is any variants of the COVID-19 virus, is the 3 vaccines will work against those variants? Yes, there are research going on. Covaxin is proved that ICMR is clearly stating that effective against new variants. This vaccine can able to fight against the new variants according to ICMR. Covishield, when those were taken, the administering the Covishield improved the hospitalization rate. You know, it is also fighting against the different variants, but it is not yet proved. The Sputnik is claimed most effective against the UK variant, especially UK variant, not very effective against South African variants and Brazilian variants. These are all the efficacy on different variants of COVID-19 viruses. And whatever, however, this efficiency or any other, there are 3 vaccines are available. As you know about in COVID-19 condition as of today, there is no systematic treatment is available to eradicate the COVID virus. The only option in front of us is vaccination. And there are a lot of myths as misinformation among the people which to take or whether to take the vaccine or not. A lot of misconception is conceived by the people, but there is no other alternative than vaccine to chase the COVID-19 virus. That the only option is COVID vaccines. According to the WHO Director General, this is the time for facts, not for fear. This is the time for rationality, not rumors. This is the time for solidarity and not stigma. So according to the WHO also advising all the globally, they are insisting the government to give the adequate vaccine for their people and try to eradicate the COVID virus at the earliest from world. And the government of Tamil Nadu and also the federal government, the union government also procuring the vaccines globally, and they are distributing to the states. And there are a lot of campaigns and social workers, the campaigns are going on for taking the vaccines, and they are telling the vaccines are too safe. So we also the front runners, healthcare professionals, we also create an awareness among the people to take up the COVID vaccines to eradicate the COVID virus at the earliest from and save our people. And we need to break the chain at the earliest by taking the vaccines. And thank you for the opportunity. And thank you so much. Thanks again.
Thank you, sir. It is really an informative session. Sir, we have some of the questions in chat box. Stella, can you please take the discussion session?
Yes, ma'am. Please, you can chat session. Let me see.
Yes, sir. Stella, over to you.
Thank you, ma'am. Good afternoon, sir.
Good afternoon.
There are a few questions in the chat box, sir. Let me read it out one by one, sir.
Please, ma'am, please.
The first question is, if there is any side effect will arise if we are not putting the second dose because we put the first dose and the second dose is not available.
Actually speaking, the ICMR and the research is telling the first dose is having more effective. You can take the second dose within 8 weeks interval. Still, you may have the efficacy, you have the immunity to fight against the coronavirus. But most of us are advising to take the second dose. Don't skip the second dose. Try to take both the doses. This is what ICMR is telling.
Okay, sir. Thank you. Next question. Is it compulsory to have duration of 84 days between 2 vaccines for Covishield?
No. Actually, the normal duration between the second dose is 2 to 4 weeks. Due to the unavailability of the vaccines, you know that very well that the people, they couldn't take the first dose itself. So giving the preferences and the choices, so they are extending the dates. There is no relationship between the 84 days. Absolutely, there is no problem. You can take the vaccines even after 84 days.
Okay, sir. Thank you, sir. Another question is whether the vaccine can be taken by a person with varicose vein.
Still, there is if you ask me particular to varicose vein, you know very well the vaccine companies and the many research institutes are in the need to produce the vaccine immediately to eradicate the COVID virus. There is no proper researches done on varicose vein. But still, if you have any previous illness, please do consult with your consultant before taking the vaccine. This is the advice from the vaccine production companies.
Okay, sir. The next question is, there are a lot of case history showing that immediately after vaccination, people get heart attack.
This myth, because there is recently one popular actor, the very famous actor, has been passed away due to heart attack. day next to when he was taken the vaccine. But there's no proof is telling. There's no scientific information is telling the immediately taking the vaccine next day you will get the heart attack. Absolutely, if you having already told you, if you are having any immunomodulators, immunosuppressive disease, if you have any previous illness, definitely you may develop an adverse effect, but it is very least number. If, for example, 1 in 100,000 they may get a heart attack. Not really. There is some previous illness may cause. Not everyone will develop the heart attack. My according.
Okay, sir. The next question also follows the same. The news that people after taking vaccine died due to blood clotting and some died to stroke. They're asking.
Yeah, same thing. You know, they may have a previous illness or some. They may have an anticoagulant therapy or they have some previous clotting disorders. They may have. So those could have developed. Again, I'm telling you, within one. Usually, if a vaccine will come to market, means it need to have a 5 to 6 years of clinical trials which has to be tested on a different category of people, different clinical conditions. Unfortunately, because of less time, the vaccine has to come to the market to prevent the death. So they couldn't do the clinical trials on every sickness, every clinical problems. So that may be a very rare conditions. Not everybody will get the stroke or heart attack. It is not a correct data also.
Okay, so thank you. Another question. If a person tested positive for COVID after the first dose of Covishield, how long should the person wait for the second dose, sir?
I don't come again. I can't understand properly.
If a person tested positive for COVID after that first dose of Covishield, how long should the person wait for the second dose?
Okay, already the ICMR has told that 3 months, minimum period, because what is the science is telling, if you are affected by COVID virus, already your body started producing the antibodies, that is already produced the chemicals against the virus, and if you no need, immediately you will not get the COVID again. So you can wait for 3 months. After that, you can take the vaccine.
Okay, sir. Thank you, sir. And another one more question, sir.
Please.
Patient with CKD, what precaution should they need to take after vaccination?
This is a very critical concern. Again, we cannot go by individual cases. They have to be consulted with the consultant before taking the vaccine. There is no proper. Already, I have gone through the complete fact sheets of the Covishield, Covaxin, and Sputnik. There is no data is given against PKD. So this is again subject for to do more research on this. Then only they can take the vaccine.
Okay, sir. Thank you, sir.
Thank you so much. Thank you. Somebody is asking the N95 mask will prevent the COVID vaccine. This is one of the method. You have to be, so you have to be always careful. Keep social distancing, keep maintaining distancing, and wash your hands with sanitizer, and do proper follow the COVID protocols which is mentioned by the government. Then we have to prevent this. There is no other option. So hope we all together will fight against the COVID and try to save our people. And thank you so much for your opportunity. And I thank Mrs. Agalya for giving a wonderful introduction about me. Thank you for the audience for patiently listening me to share my experience and knowledge on this COVID vaccines. Thank you. Thank you so much.
Thank you, sir, for answering and clarifying the doubts. Thank you, Stella, for dealing the discussion session. Next, here I invite our fourth year student, Ms. Shweta, to share her experience on caring with COVID-19 patients. Over to you, Shweta.
A very energetic good afternoon to one and all gathered here in this virtual platform. Mere theoretical study is not the knowledge in nursing field. It comes from experience. Now the world is fighting against corona. Coronavirus threatens human life. It is a disaster. It is a war. During this pandemic, all final year BSc nursing students from all the colleges are working in government COVID ward, and we are happy to be a part in this. Our esteemed institution has given us such an opportunity to serve in government hospital. During this war against the COVID, we are posted in Government Institute of Obstetrics and Gynecology Hospital, Egmore. Their nodal officer coordinated and posted us in various blocks, and we are posted in IOG block, Institute of Obstetrics Gynecology, Rajiv Gandhi block, and Omandrar block. We are being posted in morning, afternoon, and night shift on routine. We are given nice accommodation in Udupi home and served with food and refreshments daily. On behalf of all, I am Shweta, studying in final year BSc Nursing, student of Faculty of Nursing, Dr. MGR Educational and Research Institute. It's an honor for me to share my experience in COVID duty. I am very happy that I got a chance to work during this work. Here, totally 3 blocks consisting of COVID patients. In Rajiv Gandhi block consists of 100 beds and in Omadra block 150 beds with oxygen facility. We are receiving only female patients from the main hospitals with mild to moderate symptoms of COVID positive. Some may need an oxygen also. In routine, daily we are checking vital signs, oxygen saturation, and collecting the information about the patient progress. Administer medication, change the IV line, the level of oxygen based on the need. Change the mask according to the need of the patient. And also changing the position of the patient to improve their oxygen saturation and prevent bed sores. Also, we used to attend doctor rounds. It is really helpful for us to learn about COVID management. In case if the patient saturation goes less than 89%, we are shifting the patient to the home hospitals. In IOG block consisting of 60 beds and has facilities including ICU with ventilator, NICU, OT, labor room, and ward. We are receiving antenatal, intranatal, and postnatal in the Institute of Obstetrics and Gynecology block. Other routine work here are delivery, assisting in delivery, episiotomy suturing, initial newborn care, cesarean section assisting, abortion also. We take swabs from the nasal, baby nasal for COVID test, placental tissue, amniotic fluid, umbilical cord blood. We are allowed to provide care for the ventilated patient. At IOG block, all the healthcare professionals are very easy to approach and are friendly in nature. Here we are feel safe. We are provided with adequate PPE kits and refreshments and water during the working hours. We are working for 3 days and provided with 3 days quarantine. If any student falls sick, we have been advised to take the swab. Consultation is provided in the home hospital and quarantine leave is provided till the report comes and the illness is cured. By a coronavirus is a newly discovered virus. We advise the patient to follow the SMS protocol to maintain social distancing in home and isolate themselves on discharge. Wear masks whenever they are coming outside. Sanitize and clean with soap and water often. Day to day, we are seeing many people are suffering with mild to moderate symptoms with COVID positive. Sometimes we are in a position to give care for the dead patient also. It is really very pathetic and painful. My humble request to you all is to maintain social distance and only leave your house when necessary. COVID-19 is spreading in our community. So stay safe by simple precautions such as physical distancing, home isolation, wearing masks, keeping rooms well ventilated, avoid crowds, cleaning your hands and often coughing into your only tissues. Thank you. I thank everyone here who has provided.
Thank you, Shweta. We really appreciate the services what Shweta and friends providing during in this pandemic situation. Now we will have a look to the video by our students who were recovered from the COVID. Akhilya ma'am, kindly share the video.
Yes, ma'am.
வெற்றி என்றும் தூரம் இல்லை
It's truly inspiring to all. Here we come to the end of today's session. I call upon Professor Darkus Devasindhya for vote of thanks.
Good afternoon to one and all. I deem it a great honor and privilege to propose a vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. First and foremost, I thank our Honorable Founder Chancellor, Dr. A.C. Shanmugam Sir, Honorable President, Engineer A.C. Arun Kumar Sir, and our Honorable Secretary, Sri Ravi Kumar Sir, for their constant support and guidance. We are grateful to our Vice Chancellor, Professor S. Geeta Lakshmi, for our unstinted support. My heartfelt thanks to our special speakers, Dr. Balasubramanian College and Hospitals, and Dr. Shativel Armugam, Director, Study Breeze Academy, for their valuable contribution for COVID essential preparedness and about COVID vaccines. I thank our beloved principal, Professor Dr. Hema VH, for her stewardship, support, vision, and commitment. And I extend my gratitude to our NSS Wing Coordinator, Mr. Rajkumar, for his support. We are grateful to our Vice Principal, Professor Mrs. Geeta, and Associate Professor Mrs. Mocha Ragani, coordinators for this program. I owe a special gratitude to all the teaching and non-teaching faculties who have worked to ensure that this occasion became a memorable success. Last but not the least, I thank all the distinguished invitees, my dear friends and students for your cooperation in making this program a great success. So be safe, wear masks, maintain social distance to fight against this COVID. Thank you one and all.
Thank you, Cynthia ma'am. Dear participants, the feedback link is shared in the chat box. Kindly fill the form. And the announcement is tomorrow's sessions will start at 10 a.m. So I request all the participants to join the Zoom link 10 minutes before the session. Thank you all. Have a nice day.